The 76ers cannot keep acting like nothing is going on with Joel Embiid's left side of his face. And in this video, we're going to take a closer look at now what we're seeing appear to be some weakness of that entire left side of Embiid's face and not just the blinking. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to teach you about the medical side of the sports world. Now, I made a video the other day after game 2 talking about how we couldn't see Embiid ever blinking that left eye. And at the time, it looked like most of it was isolated to his eye. But now after seeing some footage here from game 3 and looking back at other things, it looks like this weakness or whatever's going on is actually infecting the entire side of the face with some mouth drooping and some other things that we've seen that really highlight what is likely going on here, and just more evidence that the Sixers need to address and say what's happening, because to continue to act like nothing is wrong, everybody sees evidence to the contrary. So this was today in game 3, and this was after that controversial play where I would argue Embiid should have been thrown out of the game. And what we're looking at here, of course, is the left side of his face. And we talked about in a previous video how we could see he wasn't blinking. And the facial nerve is a cranial nerve that controls a lot of the muscles on the side of your face. When somebody has something like a Bell's palsy, which is a term for a specific type of cranial nerve 7 injury that we don't know the cause of, whenever you have an injury or a palsy of that 7th cranial nerve, when it's in the periphery, you get weakness of that whole left side of the face. And one of the things that we'll see is the mouth drooping, because those muscles that help raise the corners of the mouth, raise the lips, become paralyzed, and so you get that drooping in the mouth. And we can see here very clearly that left side of Embiid's face looks to be drooping. Even up at the nose, that nasolabial fold looks to be drooping down that left side. We can clearly see he's not able to raise the corner of his left mouth the same as he does the right side. Same thing here as he's talking. We see that right side of the face go up, and all we see is this droop at the nose and the droop at the corner of the left mouth. We don't see as much forehead wrinkling. So over here on the right side, we see very clear wrinkles in the forehead, whereas the left side, we don't see those wrinkles. And again, right there, same sort of thing where we see that drooping on that left side. So now clear evidence that there seems to be something affecting not just the blinking, but that entire left side of the face. If we go to our anatomy tool here, so the general description for what something like this probably is just a cranial nerve 7 or a facial nerve palsy. The cranial nerve 7, the facial nerve, is a nerve that comes from the brainstem, exits out of the brain, and then innervates a lot of the muscles on the side of our face, including the blinking. And its activation, its activity, helps to keep the corners of our mouth elevated when we talk and just maintain that symmetry of the face. So the general description for something like what we're seeing with Embiid is almost certainly a cranial nerve 7 palsy. Now, there are a lot of different things that can cause irritation, weakness, lack of failure, so to speak, of that 7th cranial nerve. Whenever it's idiopathic, meaning we don't exactly know the cause, that's what we call a Bell's palsy. So a Bell's palsy is a type of cranial nerve 7 palsy, but not the only thing that happens, because you can have viral infections that can trigger this. You can have other trauma. There's other specific conditions that can lead to a 7th cranial nerve palsy, this facial paralysis. And a Bell's palsy is when it's considered idiopathic, meaning we don't exactly have a specific cause. It just sort of comes on out of nowhere. We have some thoughts about a virus that could be activating it, but you can't identify one specific trigger. That's what you call a Bell's palsy. So it's potentially a Bell's palsy, but there could also be a very known or clear cause to the Sixers medical staff if they've hopefully considered, evaluated this. Bell's palsy is just when we can't find a specific cause. So in general, facial nerve 7 weakness causing this drooping on the side of the face. There's another really interesting thing that we could actually see from back in game 2, and that was this forehead wrinkling. So whenever you have a peripheral cranial nerve 7 facial nerve injury, what it will do is it will affect the forehead muscles. So if you have a stroke, like an injury inside the brain, it's forehead sparing, and so you'll be able to wrinkle both sides of your forehead, but the face will droop. So one of the ways we determine is somebody having a stroke above the brainstem or they having a peripheral cranial nerve facial nerve palsy is if it's forehead sparing or not. So in this case, the fact that we clearly see wrinkling on the right side of the forehead, if we don't see wrinkling on the left, is consistent with a facial nerve injury as opposed to a central problem like a stroke. The other interesting thing here is there's something called a Bell's phenomenon. So whenever you blink, there's this instinctual reflex where the eyes look up, and that's done to help protect the eye. So whenever you blink, the eyes look up a little bit. That's called a Bell's phenomenon, something that happens normally in all of us and is there to protect the eye. So what we're seeing here potentially looks like that phenomenon. So as Embiid goes here to blink, we see how that left eye looks upward. Now in this position, it doesn't look like he's trying to look up. He's actually looking off in this direction. And then as soon as his right eye blinks and closes, we see that left eye go upward. That's a Bell's phenomenon to me. That looks like this Bell's phenomenon that we see, and you again will expect, because again, the eyelid's not closing because of that weakness, but you still see the eye rotate upwards as part of a protective mechanism. Now, the Sixers need to say something about this, because there's all this controversy about Embiid, his head down after interviews, after the game, like he's not a good leader. He's probably just self-conscious because of what's going on with his face. And the longer they put this off, the more potential this has to just get even messier. Most cases of facial nerve, if it's Bell's palsy, idiopathic, we don't know, most cases will resolve, but it can take time. And sometimes they don't fully resolve. We try and treat it. You might use steroids initially, sometimes antivirals. Obviously, if you identify a cause of the facial nerve 7 palsy, you treat that accordingly, and it's a different thing. But if this is just an unknown idiopathic Bell's palsy, it could linger. This could be something that could continue for weeks, months, and in some cases doesn't 100% improve. And so the sooner that this gets addressed, the sooner that it gets mentioned to end all this speculation about Embiid's leadership and just get it out there and stop making it seem like he has to try and hide this, the better. Now, there's this other question about safety of playing. And from just a standpoint of the nerve itself, unless there was trauma that they know about, but we haven't seen, or and presumably they would have found that or sat him out. If this is just an idiopathic Bell's palsy, the main risk is really just that you can't close your eyelid. And so if somebody comes in, if you get a finger to the face, you're not going to be able to close your eyelid for that protective mechanism to prevent your cornea from getting scratched. So yeah, there is some risk, but when you consider the relative risk of, playing with an orbital fracture and no protection or a mask, or playing with a broken forearm, getting a corneal abrasion is different in that risk spectrum. And that's nothing that you can specifically quantify with, a research study. That's something that the medical staff has to decide. Embiid has to be involved in that decision for that potential risk of just not being able to close your eye, protect the eye, and then something could injure the eye itself if you catch a finger, a ball, etc. So this story, just the longer it continues, the more they need to say something. I think it's interesting now. We clearly have seen that facial drooping. We've seen the lack of forehead wrinkling. Looks like we've seen that Bell's phenomenon. So a lot of factors consistent with, again, in general, a facial nerve 7 palsy. Bell's palsy is one potential way we would categorize it, but it's really a diagnosis of exclusion once we've ruled out other things like Lyme disease, other viruses, trauma, other conditions that are known to cause a potential facial nerve 7 injury. Bell's palsy is idiopathic. We don't know why. So it could be a Bell's palsy or it could be something else. Either way, pretty clear evidence of some type of nerve injury that I really hope the medical staff says something about so that we can stop trying to skirt around and force Embiid to hide this. That's it for the video, everybody. Let me know, as always, any questions or comments down below. And until next time, we'll see you later. Bye.